So this is our next topic. We're going to talk about the danger signs of pregnancy. Now, there's one issue that nurses have a lot of difficulty deciphering if it's correct or not. And it's on the issue of bleeding during pregnancy. Okay. Now, there's such a thing as implantation bleeding, and it's expected within the first several weeks after implantation. Therefore, it's not true that all forms of bleeding during pregnancy is a danger sign. Okay? Not all forms of bleeding during pregnancy is a danger sign. Okay? So we have to be clear on that. So what are the danger signs? You have this in your PDF file: absence of fetal movement, or when there is abdominal pain. So remember to check on fetal movement every hour, and there has to be at least 1 to 2 fetal movement. Persistent vomiting beyond the first trimester. Okay, this is actually a condition known as hyperemesis gravidarum, which could actually lead to fluid and electrolyte imbalance. Okay, pelvic pressure, low backache, and leaking of fluid from the vagina. So any vaginal leak, okay, which could be from premature rupture of membranes, must be evaluated by the healthcare. And of course, excessive weight gain, more than 2 pounds per week, beginning on the second trimester. This could be indicative of gestational hypertensive disease. And swelling of the fingers or spotting, which simply means there's excessive weight gain. Now remember, so if a pregnant woman tells you that the wedding ring, she has difficulty wearing the wedding ring, then assess the patient for preeclampsia or gestational hypertensive disorder. But, okay, if the patient is not pregnant, but the patient has difficulty wearing the wedding ring, well, you better ask her if she is indeed the wife. If the wedding ring doesn't fit, it could mean she's the mistress. Okay? Okay. No, just kidding aside. Okay. So let's talk about bleeding in pregnancy as a danger sign. Not all bleeding or spotting during pregnancy is serious. Vaginal bleeding during pregnancy needs to be reported to the healthcare provider, and spotting refers to a few drops of light blood flow, while bleeding involves a heavier flow. So most of the time, treatment for spotting or bleeding is plain and simple: bed rest. Okay. So what are the different characteristics of bleedings that you have to be familiar with? Spotting in early pregnancy, this could actually mean there's ectopic pregnancy infection, or this could be this could happen after sex, or there's potential miscarriage. Light bleeding in the first 4 weeks, that's implantation bleeding, it's expected. Bright red or dark brown discharge in the first trimester with grape-like cysts, that's molar pregnancy or H-mole. Okay, now usually the manifestations of H-mole and that of preeclampsia are almost the same. The only difference is that the manifestations of molar pregnancy occurs in the first trimester, whereas the manifestations of preeclampsia usually occurs beyond the 5th month of pregnancy or during the second trimester. Okay, when there's heavy bleeding before 37th week of pregnancy, then you have preterm labor. Okay. During the first trimester of pregnancy, okay, abortion and ectopic pregnancy could be the common causes of bleeding. In the second trimester, it could be associated with H-mole, pregnancy-induced hypertension, and incompetent cervix. And then the third trimester, you have placenta previa and abruptio placenta. Now, what is one thing that I'd like to highlight, okay? The causes of bleeding in the third trimester: placenta previa and abruptio placenta. Okay, now take note, if a patient, for example, here's a scenario, had a car accident and all of a sudden had abdominal pain that is coupled with bleeding, what do you suspect the patient to be suffering from? Abruptio placenta. Is that a danger sign? It is. And so therefore, you have to keep the patient on bed rest and expect that the patient will have to undergo your ultrasound. Okay? So it's very important to monitor perineal pad saturation within 30 to 60 minutes in a postpartum client, which may be suffering from bleeding. If there is 1 to 2 inch stain, it's considered scant or blood loss of 10 ml, 4 inches, light to small, or 10 to 20 ml, 4 to 6 inches, moderate, 25 to 50 ml. And if the perineal pad is saturated within an hour, it indicates heavy bleeding. So ultrasound is the diagnostic test of choice for bleeding disorders of pregnancy. So let's try answering a sample question. A 30-week pregnant client was in a car accident. Initial assessment reveals bleeding. The nurse should prepare the client for, this is what I'm trying to tell you guys. What's the diagnostic test for bleeding in the third trimester? So that's ultrasound. Okay, now, what are these tests? Okay, non-stress test is a test for fetal well-being. You have to induce fetal movement and then monitor acceleration of the heart rate. Okay, if there's an acceleration above 15 beats per minute in 2 periods within a 5-minute time frame, then the test is positive. It means the baby is responsive. Contraction stress test is a test for fetal heart rate deceleration. So it correlates uterine contraction with the fetal heart rate. So this is trying to test if the baby can withstand uterine contraction during a labor process. In this case, if the patient's heart rate drops, deceleration means slowing of the heart rate when uterine contraction occurs, then it could mean that the baby may not be well enough, okay, to withstand the stress of the labor process. Now, take note also that there are 3 different types of deceleration. Okay, you have your early, late, and variable deceleration. Early deceleration is expected because it's due to head compression. Late deceleration is due to placental insufficiency, and it could be indicative of fetal distress, so it's a priority. Variable deceleration could be due to cord compression. So pay particular attention to that concept. Now, biophysical profile is also a test of fetal well-being. There are 5 specific criteria. You have fetal breathing, fetal movement, fetal heart rate, reaction to non-stress test, and amniotic fluid volume. Okay, based on the 5 criteria, okay, the baby is graded. Okay, you don't have to remember about biophysical profile, just these 2. Okay, excellent. Let's move on. So once again, when the non-stress test is considered positive, you have increased heart rate. For contraction stress test, it's considered positive when the heart rate decreases or decelerates. A positive non-stress test indicates that the baby is okay, healthy, responsive. A positive contraction stress test indicates that the baby is not okay. The baby may not be able to withstand the stresses of the labor and uterine contraction process. Okay? Okay. So which one should be your priority? Well, the baby with a positive contraction stress test. You need to immediately refer the mother. Okay?
Okay, thank you very much for joining me. I am your mentor. Don't forget, mentor your fact check buddy. And this is me asking you if you have other requests, please don't hesitate to send me a note through my email, mentor.raygapuz@gmail.com. Bye-bye. Thank you. Here's the disclaimer.